After 80, your body stops playing by the rules you spent a lifetime learning, and most people never see it coming until it is too late. If you are approaching 80, already there, or you love someone who is, what I am about to share could genuinely protect their independence and their life. My name is Dr. Adrian Voss, and today I am going to tell you the 5 things that happen to every human body after the age of 80. Things that most doctors only explain after the damage is already done. That ends today. If you have not already, hit that subscribe button and tap the bell. I release content like this regularly, and I do not want you to miss a single video. Now let us get into it. The first thing that happens after 80, and this one catches almost everyone off guard, is that your muscles begin to disappear at a rate unlike anything you have ever experienced before. Now I know what some of you are thinking. Muscle loss starts in your 30s. This is not news, and you are right. But here is what most people do not understand. Between 30 and 70, muscle loss is slow and manageable, about 3 to 5% per decade. After 80, that number jumps to 15% per decade, sometimes faster. This condition has a name. It is called sarcopenia, and after 80, it becomes one of the most serious threats to your independence, your mobility, and your life. Here is why it matters so much. Muscles are not just about strength. They are what keep you upright. They are what catch you when you stumble on a crack in the sidewalk. They are what allow you to get out of a chair, climb a staircase, and carry your own groceries. When muscle mass drops below a certain threshold, your risk of falling increases dramatically, and a fall at 80 is nothing like a fall at 40. Studies show that 20 to 30% of elderly adults who suffer a hip fracture die within 1 year. Not from the fracture itself, but from the complications, the immobility, the infections, the rapid decline that follows. So what do? Resistance training. And no, I am not talking about heavy lifting. I mean chair squats, resistance bands, light dumbbells, body weight movements, 2 to 3 times per week, consistently. And protein. Most seniors over 80 are not eating nearly enough. Aim for at least 1 gram per kilogram of your body weight every single day, spread across your meals, not all at once. The second thing that happens after 80 is that your brain begins to process information differently. I want to be careful here because there is a huge difference between normal aging and dementia, and too many people confuse the two. After 80, it is completely normal to take a little longer to recall a name, find the right word in a conversation, or make a decision. This is not Alzheimer's. This is your brain operating with slightly less speed, which is a natural part of aging. However, and this is important, after 80, the risk of actual dementia does increase significantly. By age 85, roughly 1 in 3 people will have some form of dementia. That is a number we cannot ignore. The brain, just like your muscles, needs to be used and maintained. Research consistently shows that people who stay mentally active, socially engaged, and physically moving have far lower rates of cognitive decline than those who become sedentary and isolated. The biggest mistake I see in patients over 80 is withdrawal. They stop going to church, they stop meeting friends, they spend hours alone in front of the television. Social isolation is one of the most powerful accelerators of cognitive decline we know of. Your brain needs conversation. It needs challenge. It needs novelty. Join a book club. Play cards. Learn something new. Volunteer. It does not matter what it is, as long as it keeps your brain engaged and keeps you connected to other people. And one more thing about brain health after 80 that most doctors skip over: sleep. Your brain uses deep sleep to flush out toxic proteins, including beta amyloid, which is directly linked to Alzheimer's disease. Poor sleep means those proteins accumulate faster. Do not accept bad sleep as just part of getting older. Talk to your doctor. There are real solutions, and they could make a significant difference in protecting your mind. The third thing that happens after 80 is that your bones become significantly more fragile. After 80, we reach a point where bones have lost so much density that even minor impacts can cause fractures. A stumble, bumping into a piece of furniture. In severe cases, a forceful sneeze can cause a spinal compression fracture. And once you have one fracture, your risk of having another one doubles or even triples. What can you do? First, get a bone density scan if you have not had one recently. Know where you stand. Second, calcium and vitamin D. Most adults over 80 need at least 1,200 milligrams of calcium per day and 800 to 1,000 IU of vitamin D. I will tell you right now, the vast majority of seniors I see have dangerously low vitamin D levels. A simple blood test confirms it. But beyond supplements, the single best thing you can do for your bones is weight-bearing exercise. Walking, standing, gentle dancing, even repeatedly sitting and standing from a chair counts. Bones respond to mechanical stress by laying down new tissue. If you stop moving, your bones receive a signal that they are no longer needed, and they weaken even faster. Every step you take is literally telling your bones to stay strong. The fourth thing that happens after 80 is a decline in balance and coordination, and this is where things get genuinely dangerous. After 80, your inner ear, the system responsible for spatial orientation, becomes less accurate. Your proprioception, your body's sense of where it is in space, also declines, and your vision often deteriorates further due to cataracts or macular degeneration. Weaker muscles, fragile bones, a less reliable vestibular system, declining vision. Together, this is a perfect storm for falls. 1 in 3 adults over 65 falls each year. After 80, that number climbs higher, and the consequences become far more severe. So what do you do? Balance training every single day. Standing on one foot while holding a chair. Heel-to-toe walking. Tai Chi adapted for seniors. These exercises train your brain and body to maintain stability. And here is the encouraging truth. Balance can be improved at any age. Even if you feel unsteady right now, consistent training makes a real difference. Also, ask your doctor to review every medication you are taking. Blood pressure medications, sleep aids, antihistamines, certain antidepressants. Many of these cause dizziness and increase fall risk. Sometimes a simple adjustment changes everything. And please, if you need a cane, use a cane. If you need a walker, use a walker. If you need grab bars in your bathroom, get them installed today. These are not signs of weakness. They are tools that keep you independent and keep you alive. I have seen too many patients refuse assistive devices out of pride, and then one fall took away their independence permanently. Do not let that be your story. The fifth thing, and I believe this may be the most important one, is that your immune system becomes significantly weaker after 80. This process is called immunosenescence. Your body produces fewer new immune cells, the ones you have become less effective, and your inflammatory responses become unpredictable. This is why a cold that a 30-year-old shakes in 3 days can land an 80-year-old in the hospital. It is why pneumonia is one of the leading causes of death in this age group. It is why a urinary tract infection, minor for a younger person, can cause confusion and serious complications in an elderly patient. What can you do? Nutrition matters more than ever. Vitamin C, vitamin D, zinc, and selenium are all critical for immune function. A varied diet with fruits, vegetables, lean protein, and whole grains gives your immune system what it needs to function. Stay current on your vaccinations: the flu shot, the pneumonia vaccine, the shingles vaccine. These can be genuinely life-saving after 80. Talk to your doctor about which ones are right for you, and stay physically active. Even moderate exercise, a daily walk, gentle stretching, light resistance work meaningfully boosts immune function by increasing the circulation of immune cells throughout your body. And I want to say this clearly because the research on this is striking. Loneliness is not just an emotional problem, it is a biological one. Socially isolated elderly adults have significantly weaker immune responses than those with strong social connections. Loneliness raises cortisol, increases inflammation, and suppresses your natural killer cells, the immune cells that detect and destroy cancerous cells and viruses. Staying connected is not just good for your soul. It is essential for your survival. Turning 80 is not a death sentence. I have patients in their 80s and 90s who are vibrant, sharp, active, and deeply engaged with life. They are not genetically lucky. They are simply people who took their health seriously, who kept moving, stayed connected, ate well, worked with their doctors, and refused to accept decline as inevitable. Yes, the 5 things I talked about today are real. They will happen to some degree no matter what. Your muscles will weaken, your brain will slow down, your bones will become more fragile, your balance will decline, and your immune system will lose some of its power. These are biological realities. But the speed at which they progress and the impact they have on your quality of life, that is largely in your hands. Every single day, you have a choice. You can sit back and let these changes take over, or you can fight back with movement, with nutrition, with connection, with rest, and with a stubborn refusal to give up on yourself. I have seen 80-year-olds who move better than some 60-year-olds I know. I have seen 90-year-olds with sharper minds than people half their age. Age is a number, but how you age, that is a decision. If this video helped you, please share it with your parents, your grandparents, your neighbors, someone you love who needs to hear this. Hit the like button, subscribe if you have not already, and leave me a comment below telling me what topic you want me to cover next. I read every single one. This is Dr. Adrian Voss, reminding you that it is never too late to take control of your health. Your body is more resilient than you think. Give it the movement, the nutrition, the rest, and the care it deserves, and it will carry you further than you ever imagined. Take care of yourselves. I will see you in the next video.